Welcome. Today, we're breaking down the latest evidence-based cancer screening guidelines for average-risk asymptomatic adults. Early detection saves lives, and knowing when and how to screen is crucial. These recommendations are based on the latest updates from the USPSTF and the American Cancer Society. Remember, if you're at higher risk due to family history or other factors, you may need a different approach. Always talk to your clinician. Let's walk through each major cancer type, starting with breast cancer, and clarify what you need to know for your health. Women at average risk. Breast cancer screening starts at age 40, according to the 2024 USPSTF recommendation. The American Cancer Society suggests starting annual mammograms at age 45, then switching to every 2 years at 55. If you're between 40 and 44, you have the option to begin earlier. The key is to have a conversation with your healthcare provider about your personal risk and preferences. High-risk women should begin risk assessment by age 25 and may need earlier and more intensive screening, including MRI. Screening frequency depends on your age and the guideline you follow. USPSTF recommends mammograms every 2 years from age 40 to 74. The ACS advises annual screening from 45 to 54, then every 2 years after 55. Screening can continue past 74 if you're healthy and expect to live more than 10 years. The decision to stop should be individualized based on your health and preferences. Always consult your clinician for personalized advice. Cervical cancer screening begins at age 21. For women aged 21 to 29, a Pap test every 3 years is recommended. From ages 30 to 65, you have several options. HPV testing alone every 5 years preferred, co-testing with Pap and HPV every 5 years, or Pap alone every 3 years. Screening before age 21 is not recommended, and the ACS allows primary HPV testing starting at age 25. These options help tailor screening to your needs and risk. Men over age 65 can stop cervical cancer screening if they've had adequate prior screening, meaning 3 negative Pap tests or 2 negative HPV tests in the past 10 years with no history of serious cervical disease. If you haven't met these criteria, continue screening as advised. It's important not to screen women under 21 as the risks outweigh the benefits. Always discuss your screening history with your provider to make the best decision for your health. Colorectal cancer screening should begin at age 45 for average-risk adults, according to the USPSTF. This is a change from previous recommendations, reflecting rising rates in younger adults. The most common screening methods include colonoscopy, stool-based tests like FIT or GFOBT, and new options like Cologuard. The choice of test depends on your preferences, access, and medical advice. Early screening can catch cancer before symptoms appear. Screening frequency varies by test. Colonoscopy is recommended every 10 years, while stool-based tests like FIT or GFOBT are done annually. Cologuard is every 1 to 3 years, and CT colonography every 5 years. Routine screening continues until age 75. For ages 76 to 85, the decision is individualized based on health and prior screening. After 85, routine screening is not recommended. Any positive stool test should be followed by a colonoscopy. Lung cancer screening is recommended for adults aged 50 to 80 who have a 20-year smoking history and currently smoke or have quit within the past 15 years. Screening is not advised for non-smokers or those who quit more than 15 years ago. The only recommended test is low-dose CT, LDCT, which can detect lung cancer early. If you're unsure about your risk, talk to your healthcare provider for guidance. Those eligible, lung cancer screening with LDCT should be done annually. Screening continues until age 81 or for up to 15 years after quitting smoking. If you become unfit for curative surgery, screening should also stop. The goal is to catch lung cancer early in those at highest risk while avoiding unnecessary tests in others. Always review your smoking history and health status with your provider to determine the best plan. Prostate cancer screening is a shared decision for men aged 55 to 69. High-risk men, such as those with a family history or African ancestry, may start as early as age 45 or even 40 for very high risk. Screening involves a PSA blood test. If your PSA is less than 2.5, testing every 2 years is reasonable. If higher, annual testing may be advised. Routine screening is not recommended after age 70. Discuss the benefits and risks with your provider. Men choosing to screen, the frequency depends on PSA levels. If your PSA is below 2.5, screening every 2 years is sufficient. If it's above 2.5, annual screening is recommended. Routine screening is not advised for men over 70. The USPSTF gives a grade C recommendation for ages 55 to 69, meaning the decision should be individualized. Always weigh the benefits and potential harms with your healthcare provider. Routine screening is not recommended for ovarian, pancreatic, testicular, or thyroid cancers in average-risk asymptomatic adults. The potential harms of screening outweigh the benefits for these cancers, according to the USPSTF. If you have symptoms or a strong family history, your provider may suggest different strategies. For most people, focusing on recommended screenings and healthy habits is the best way to reduce cancer risk. Whole-body skin cancer screening by a clinician is not routinely recommended for average-risk adults. Instead, monthly self-exams are encouraged to check for new or changing moles or spots. If you notice anything suspicious, see your healthcare provider for an evaluation. The USPSTF finds insufficient evidence to recommend routine clinician skin exams. Staying alert to changes in your skin is a simple, effective way to catch problems early. You have a family history of cancer, genetic predisposition, or other risk factors, you may need earlier or more intensive screening. High-risk individuals should have a personalized plan developed with their healthcare provider. This may include starting screening at a younger age, using additional tests like MRI, or screening more frequently. Always share your family and medical history with your provider to ensure you get the right care. Sum up, following evidence-based cancer screening guidelines can help detect cancer early and save lives. Start screening at the recommended ages, follow the suggested intervals, and stop when it's no longer beneficial. If you're at higher risk, work with your provider to create a tailored plan. Remember, these guidelines are for average-risk asymptomatic adults. For personal advice, always consult your primary care physician. Stay informed, stay proactive, and prioritize your health.